Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on this Wednesday, February the 16th. I have two of my friends with us today, Mar Doering and Connor Doering.
Thank you, yes.
All right, Mar from Paws Medical and Behavioral Center. Good to have you here, Mar.
Thank you so much.
Today you wanted to talk about something that I think might be a sore topic for a lot of people because they love their animals so much.
That they actually
can
kill them with kindness.
They can kill their animals with love or kindness.
With love and kindness. But the wonderful thing about it is if you understand what you're doing and what not to do, then you can prevent this really, really painful, scary disease. So the disease is pancreatitis.
Pancreatitis. And when you in that email you said your husband calls it killing your dog with kindness.
Yes.
And how are you doing that?
Well, the pancreas does two big things. One is it produces insulin to help regulate sugars, which is wonderful. The second thing it does is it helps to digest food with an enzyme. And that enzyme comes out especially when they have rich foods, unusual foods, or fatty foods. So it helps the body to digest them. However, if all of a sudden they get in, let's say, the garbage, or you drop something rich, or you have a party, or let's say over time, a lot of people will say, well, you know what? I feed them fat all the time. They get bacon, they get this and that, and then all of a sudden they got sick. I don't understand why all of a sudden. It's just the pancreas did its job as much as it could, as long as it could, and it just got overpowered. So this could happen very acutely, which is very, very painful, and you will be sadly very, very surprised because all of a sudden your doggy will stop eating, they will be vomiting often, they will really be in a lot of pain.
So let's back up here.
Sure.
If you're feeding your dog people food,
right,
which you should not do,
it would be there are some people foods that are bland foods that are easy for them to digest. You need to talk, and I could give you a list, but talk to your vet. They will tell you.
Okay.
But there are many foods that are too rich, are too unusual, or because they never had them before, or all of a sudden you're giving them a lovely treat, even if it's a doggy kind of treat, but it has extra fat in it, it requires more of the pancreas than sometimes the pancreas can handle. It usually happens when they're middle-aged or older that you'll start to see the symptoms where maybe they could handle that wonderful treat or bacon or something very, very rich. At Thanksgiving, you see it. At holidays or parties, you see it a lot.
Now, is it something that is going to give a warning sign before it just comes out all at once?
Often it does not give a warning sign.
And what happens then?
They will, all of a sudden, you think you've done a wonderful thing, and you look over and your dog is just not looking well. Oftentimes they start vomiting, and sometimes very frequent vomiting, but you don't want to wait. If you see they're not eating, they're vomiting, they look like a dog that does not feel well, you want to call your veterinarian, especially if it's following, maybe they got into the garbage or, excuse me for a second, or they went ahead and somebody gave them something at a party. Not something poisonous, just a little more rich than they're used to. You want to call your veterinarian.
And that can come on that fast.
It can come on very, very fast as they start to digest the food. Sometimes you'll notice you'll pick them up, and they'll be painful when you pick them up in their abdomen, sometimes right on the right side. But it really is painful, And what it requires is not for them to have more food or to leave the water out so that they can hydrate themselves. They need to see a veterinarian. Oftentimes they need at least injectable medicines because they can't keep orals down. Sometimes they need actually to be off food for a day, 2 days, sometimes in an ICU setting with IV fluids.
You're making it sound very,
It's very dangerous and potentially can threaten their life if you let it go on. The reason I mention this, I had a big emergency just a couple of days ago, right before we had a big snowstorm. Right as the snow was getting ready to fall, we had somebody call and say, "Oh yeah, we had a barbecue, fed our doggy some pork chops, and now it's been vomiting." Well, by the time I saw it, because they waited 24 hours, that doggy was very, very
Were you
ill.
able to save the dog?
Yes, 100% yes, but this is the other part of it. The pancreas may not recover fully. So you have to know that if this happened once, and your veterinarian will tell you this, if it happened once, the pancreas may not be able to digest food. Sometimes never again. Sometimes it can digest a certain amount of food, but you have to have your veterinarian's guidance to make sure, again, this is a preventable problem. Doesn't mean you can't feed any table foods. You need to be advised what you can feed, what's the best for your doggy, what you can do to help them, and to prevent it, to prevent a problem when you are trying to be kind and loving and make sure that your doggy gets a special treat. You don't want to, like my husband calls it, kill them with kindness or even make them sick with kindness. You never want to do that.
I think probably the best thing, and this is the rule that we have at our house, our dogs don't get any people food, period. There's no people food for them. And sometimes if somebody comes over and they want to slip them, nope, we don't do that.
That's good.
They only eat their dog food. And I learned that the hard way too, because I had a dog, Princey, many, many years ago, when she decided that she was only going to eat boiled chicken.
Oh boy.
And we used to boil a chicken every day for her because she decided she was not going to eat dog food. And my veterinarian said, that's not good because she's not getting everything
exactly.
So it's hard to wean them back on to the dog food. Just don't take them off the dog food.
Yeah, I think that's a very good point. And you do want to talk to your vet. Again, if they've ever had this problem, the person that this happened to was actually feeding a food that would not be okay because it does have too much food, too much fat in it.
How do they get in touch with you, Mar, for more information?
They can call me. We're in Holt Summit at All Paws, and it's 573-896-4040.
Okay. Pleasure having you and
Thank you.
Connor here. Connor's quite the little gentleman, isn't he?
Yes, he is.
He was a puppy mill dog, and boy, he is in the lap of luxury now.
Oh, he makes me happy every day.
Thank you, Mar.
Thank you.
Pleasure having you here. We're out of time for today. If something you'd like to hear or see, please drop me an email, pepperp@missouri.edu. When you go out and about, as I say, continue wearing that mask, but it's okay to smile under the mask and be nice to each other. See you tomorrow. Bye-bye.